Students, as we continue on the topic of sustainable development, we have arrived at the issue of youth and healthy lifestyles. Health is considered a major predictor of individual and community success. Worldwide, many young people are experiencing challenges with their health. This is due to varying economic, social and environmental factors. This was clearly evident in the previous units, which focused on globalization and climate change. In this session we will be discussing the global situational analysis of youth and their health. Can anyone tell me what they learned from Principle 1 of the Rio Declaration 1992?
Miss, this principle states that human beings are at the center of concerns for sustainable development. They are entitled to a healthy and productive life in harmony with nature.
Yes, that is correct. Therefore we can clearly see that we all have an integral part to play in sustainable development. The questions that we are faced with include: what are the challenges that youth face with their health? How can youth become an integral part of sustainable development, and who can assist them in achieving a healthy lifestyle? Do you all have any ideas on how to assist youth like yourself attain and maintain healthy lifestyles?
Miss, what about a youth rally or a school campaign?
The school campaign sounds like a great idea. You can interact with your peers, educate them about pertinent health issues that affect youth globally, and discover solutions to the health problems that many youth face. You can be your own advocates.
The next week.
Good morning, students. We are honored as 7th graders to spearhead this campaign, which is entitled Our Health, Our Future. This undertaking is geared at educating the student body about the need to maintain a healthy lifestyle so as to secure our generation. Are you aware that some of the major health issues facing our youth today include HIV/AIDS, tuberculosis, hunger and undernutrition, and sexual and reproductive health problems? Evidently, some of the major contributing factors include the socioeconomic background, urbanization, the impact of gender inequality, and peer pressure. I will now hand you over to our next speaker, Miss Mills, who will provide an overview on the present health situation of youth globally.
Good day, students. I am here to reveal some startling information on the health status of youth globally. How much do we know about HIV/AIDS? Did you know that Sub-Saharan Africa and the Caribbean account for the highest prevalence of persons living with HIV/AIDS? As it relates to gender and rate of infection, young females, especially girls and young women, have suffered the most from this pandemic. The global data in terms of the proportion of women living with HIV is 50% of the affected population. This is definitely a cause for concern. Data from the National Alliance of State and Territorial AIDS Directors. HIV/AIDS, crisis among young Black and Latino gay men and other men who have sex with men revealed that HIV among 13 to 29-year-old gay male is 48% Black and 21% in Latino males. I know that adolescence is a stage where youth begin to explore their sexuality. Thus, we are vulnerable to exposure and contraction of the disease, but we need to re-examine our patterns of sexual behavior influenced by gender ideologies and mass media. Poverty, early marriage and sexual abuse. A significant number of lives have been lost. This is an indication of a decrease in human resources and financial investment to research, prevent and treat this disease. What about our sexual and reproductive health? Teenage pregnancy is an issue that is directly related to sexual and reproductive health. A study conducted by PAHO, 2003 on sexual health and development of adolescents and youth in the Americas revealed the following data. Approximately 50% of adolescents under the age of 17 are sexually active in the region. Although for young women, most of this sexual activity is within marriage. 34% of adolescent girls in Trinidad and Tobago are married or in union by 18 years of age. Between 53% and 71% of women in the region have had sexual relations before the age of 20. Furthermore, the average age of first sexual intercourse is approximately ages 15 to 16 for girls in many Latin American and Caribbean countries. Teenage mother faces many challenges such as premature and complicated deliveries, low birth weight babies and nutritional deficiencies. Also, they are forced to discontinue school. Teenage mothers are not emotionally, mentally and financially prepared to take care of another human being. As a result of this insecurity, many of them resort to abortions. These are some of the most dominant health issues facing our youth. Others include poor nutritional practices, pregnant women living with HIV/AIDS, female gender mutilation, youth morbidity and mortality, basic hygiene, smoking and school enrollment.
Thank you, Ms. Mills, for enlightening us with some of the health issues affecting our youth. Our next speaker, Mr. McCarthy, will now focus on the socioeconomic impact on health.
Thank you and good day, everyone. As it relates to youth, American Psychological Association views socioeconomic as the social standing or class of an individual or group. If you are a part of a family whose economic position affords you the opportunity to have proper access to health, education, training and employment opportunities, access to proper health care is increased. A lack of these amenities contribute to youth not being able to gain an easy transition from school to acquiring meaningful employment, therefore, hindering their ability to take care of their health concerns. Another concern is urbanization. Youth are exposed to greater job opportunities in the urban areas. The main aim of this move is to improve their standard of living through the provision of their basic needs as well as health care. The pressure that many of us face today include achieving a good-paying job, a fancy car or sophisticated gadgets. By achieving these, the struggles that accompany it results in our mental and emotional anguish that our public health system is not adequately equipped to handle. Family plays an important role in youth health. Families need to be nurturing, with both parents serving as role models. Our church and education system must also be a constant supportive environment that socialize with the family to promote healthy behavior. As a result of these factors, we the youth need to be heard. Therefore, as part of our campaign, we propose the following action: age-appropriate sexuality education, access to basic health services, media campaigns highlighting safe sexual behavior and the proper use of the condom. Additionally, in the fight against HIV/AIDS, we cannot ignore the role of the school, youth-serving organizations, government institutions and medical groups and organizations. Communities that adopt an active role in engaging their youth are those that are less susceptible to risky behaviors from youth. When youth become a part of the decision-making process, encouraged and supported to attain their full potential and receive mutual respect from society, they are more likely to adopt a healthy lifestyle. Some of the measures that can be adopted within the community include arts. Youth can be involved in creating campaigns at school. Music, they can express themselves through song, by hosting concerts in their community. Politics, by participating in youth parliament in their country. School or community volunteering, participating in sport activities that they excel at, and being afforded the opportunity to be mentors to the younger children in the community. And a community website can be created with the funding from local businessmen providing information on youth workers, youth activities and youth groups. Health sector reform can expand coverage of essential health services through a package of quality health services to improve access and reduce morbidity and mortality rates. This can be achieved by promotion of full community participation in health services delivery through involvement in the planning, operation and control, and promoting the contracting of health services to take advantage of private sector resources and expanding the availability and access to quality health services. According to a document entitled Legislation and Policy for Adolescent Health in Latin America and the Caribbean, adolescent health is best dealt with in a comprehensive, holistic manner. It was revealed that health policy through the following sectors needs to be addressed. Health laws and policies on youth health should encourage health promotion and positive behaviors to eliminate barriers to accessing such health services as family planning, contraception, treatment of sexually transmitted diseases, and other needs. Education laws and policies should encourage both formal and informal education and vocational training for both young men and young women. Schools' curriculum should include components on nutrition, hygiene, wellness, HIV/AIDS, reproductive health, substance abuse prevention, transit safety, and physical fitness, economic, labor and social security. There should be minimum ages set for minors to work, as well as restrictions on their working in unhealthy environments. Commerce and industry. Comprehensive laws should restrict the sale of tobacco and alcohol to youth. Justice. It must be noted that though there are several existing policies/laws to perpetuate youth's health, the problem lies with the inability to have them enforced. Therefore, The justice sector should encourage compliance with legislation to protect youth. One key area is vehicular safety. Laws relating to drugs and alcohol, seatbelt use, and driving age can be enforced.
Thank you, students, for such a comprehensive outlook on youth and healthy lifestyles. For further questions, you can meet with our representatives or access these references.